Hey, good evening. David Michael Smingy here, and my wife Britta. Um, so thank you for watching, and certainly appreciate all y'all who've been supporting us the last couple of weeks. Over the last few weeks, Britta and I have been able to go and have Britta harvested, meaning that we went and took eggs and we froze them. And we chose eggs over embryos for different reasons, and I'll probably talk about those another time. But the big question that we've got this week, and the question that we need prayer for, is kind of what are we going to do in terms of next steps in treatment. So now that Britta has been harvested, the question is we have to do a treatment. In terms of treating tumors, there's a couple different ways you can go about treating tumors. A tumor being something that essentially is a cell line that for whatever reason has decided to be functionally essentially immortal, meaning that they don't die like normal cells do, right? So a tumor cell has decided that, well, our mechanisms for reproducing ourselves are either out of control or we're not going to be able to kind of have that pre-programmed death. I mean, cells naturally turn over, but tumor cells don't. And they grow and they invade and they spread different places, and they can be a problem. So there's a lot of different ways we can interrupt that process in medicine. There's a few different major ways. I guess your first option looking at a tumor is doing nothing, and it's usually not the right answer. There's a few situations where you might want to watch something grow or something that's just, probably not going to be a problem. You think about sometimes prostate and sometimes other tumors where you just think, we'll probably do more harm than good by going after this than we will treating it. So those situations do happen, but in Britta's case, certainly we need to do something about it. Second option is surgery, right? So surgery being going in and cutting the thing out and removing it. This usually works pretty well for most solid tumors. You think about things that kind of grow in one place, you go ahead and cut them out if they haven't spread anywhere. Usually it's not a problem to go ahead and remove them. In Britta's case, we did surgery a few years ago, and then we did surgery again. Problem with brain, as you might guess, there's a lot of eloquent areas and important things in your brain. You can't just go cutting things. You can, but it's usually not well advised, because usually it becomes unethical pretty quickly. In Britta's case, you would probably lose motor and entire of her personality easy as first kind of damage that you'd see from that, from going after all of it from a surgery perspective, so you just can't. And of course, then her tumors being infiltrative too, you think about it's almost impossible to remove brain tumors surgically, just being honest. Yeah. Option 3 is radiation or some kind of other radiotherapy. People think about radiation, they think about x-rays, and you'd be right, but there's different types of radiation that we can do. The more novel treatments, things being like proton therapy, a little more precise than traditional x-rays. And different ways you can irradiate somebody. So you can go ahead and say, well, let's do a whole brain radiation, get the whole thing. It usually causes problems like dementia if you do that, and other sort of cognitive problems and personality issues and changes. Usually not recommended to do that. In recent years, medicine's kind of moved towards, well, let's try and get just as little of her brain or as of a person's brain as possible. We have to irradiate something. The idea of radiation, of course, being that radiation, one of the first things we had was like, well, we noticed that when we hit people with x-rays, they tend to have parts of them die, and they also have parts of them mutate, so naturally it's a perfect treatment for treating tumors. And it's not a perfect treatment, but it is a treatment. And it was one of the first ones that we had. And it works in some situations. The problem is that there's collateral damage, right? So we hit these tumor cells, and the idea is we damage them enough that they can't repair themselves, so they eventually die. But you also get a whole bunch of stuff in the way. So natural healthy cells, get damaged too, and that can have a lot of implications down the road, particularly when you're dealing with brain. For anybody who may have had a friend or family member, or maybe themselves, who've had radiation, they remember, like, this is where they radiated me, and they've usually got a track or a scar or something, or some sort of abnormal skin tissue or some finding that's kind of some permanent collateral damage that reminds them of their tumor. It is what it is. You damage things along the way. You cause harm while trying to treat. And it's a complicated question if radiation is a good answer in Britta's case. With Britta, and this does not apply to every brain tumor, with Britta's tumor being something that's kind of slow growing, but still growing relatively quickly, You want to hit this potentially with radiation and destroy parts of it, but you're going to hit good stuff along the way too. I'm kind of nervous about radiation therapy in Britta, to be honest. If it was just one tiny spot, that's one story, but in Britta's case, we'd essentially be irradiating about a 1 centimeter margin from her tumor cavity, which was pretty large, and then also kind of the tumor itself, and there's a lot of stuff in the way. You're looking at all of your right motor cortex, like that's a problem, like that's a lot of your motor function that controls your left side. And then you've also got kind of that personality area too, but it doesn't have much, it doesn't really have a right frontal lobe left, so you're looking at left frontal lobe, and that would be a lot of damage there potentially too. And then you're also getting kind of lower, the tumor kind of goes down to areas that are sensitive for hormone production. So you might end up on different medications long term to help some of the consequences of that. So there's a question there. Another way of treating tumors is chemotherapy, right? So chemotherapy, the idea behind it is somewhat similar to radiation, but a little bit different. So chemotherapy is we put chemicals inside somebody, and these chemicals go different places. And ideally they go into tumor cells, and they have different mechanisms of working, but essentially they prevent cancer cells from growing or potentially build up a sort of a toxin within those cells, and eventually they die. And that works decently well too. Again, brain tumors kind of being a weird spot too, but traditionally chemotherapy has had less outcomes. So Britta's got a tumor that's particularly chemosensitive, and it may actually be an option worth doing. Chemotherapy also has consequences too. Again, the idea is you're killing these rapidly or more rapidly dividing cells with chemotherapy. Problem is that you have cells in other places of your body that are developing rapidly too, things like your gut, for example, or your white cells and your red cells, and sometimes your platelets. These things turn over pretty quickly. Your hair turns over pretty quickly too. That's why people lose their hair on chemotherapy. In Britta's case, she may actually get to keep her hair, as their chemotherapy does not penetrate her skin very well. But, certainly things like white cells, red cells being important for fighting infection and carrying oxygen to your tissues, respectively, are very important considerations and things that we need to think about too. Another option would be doing radiation and chemotherapy. And another option behind that would be doing, or hopefully in the future, doing things that are more novel, things like immunotherapy. People are coming up with very clever ways of essentially vaccinating themselves against their tumor. So they train their immune system to take care of the cancer or tumor. And different antibodies we can make that might help too. That's a type of immunotherapy. There's these really interesting therapies where they take white cells out of somebody and train them to fight your tumor, then put them back inside of you. But those are different kind of cancers. But maybe someday we'll be able to see those. And who knows what kind of the future holds. There's a group that even went and injected polio vaccine, or polio, the virus, into people's brains in the case of a glioblastoma. And it sorted out. Okay, definitely, it showed improvement, but the patient still ultimately expired too in a short time, but it did show improvement. So there's these interesting therapies out there we can consider, and then there's kind of the more untraditional medicine, things like homeopathy, chiropractic, all those things too, and not much evidence to support those, unfortunately. Maybe one exception with a higher dose homeopathic treatment, but essentially it would be treatment with a plant, which, anyway. Big question I need prayer for is, do we do radiation or chemo, or radiation and chemo? And I think I need to stop and kind of explain the question behind there. So, and even within those treatments, there's different questions of, well, for radiation, for example, like, what are we going to radiate? How much do we radiate? To what amount of radiation, in units of gray, do we treat people? And then what are the long-term side effects of that? Does it affect your quality of life? Absolutely, I think it would. And then chemotherapy, question is, which chemotherapy drug or drugs, how often do we take them? And how many cycles of chemotherapy, meaning if you take drug A and then you wait a few weeks and take drug A again, that's one cycle, sort of. how many cycles of chemotherapy do we do? How long do we do them for? How long do we separate different drugs? There's a whole bunch of different questions that have to go into that. So that's what I need prayer for. I'll probably do a second video because it's going to be a little bit long. Kind of the merits of what kind of treatment options specifically we have for those that are interested in Britta's case, and just pray for us and that. What's the next best step forward? I'm leaning more towards just chemotherapy for the kind of long-term consequences of radiation. And there's some evidence to support that too, but it really is more of a best guess kind of situation. And we have a very great neuro-oncologist. I'm grateful for him, and a great neurosurgeon too. So, thank you for watching. I really appreciate your support, love, and prayers. Someone asked me to make a video about how I could just help you, and I'll get to that too. But I've got a lot on my mind this week. We have that appointment Thursday, so I'll try and follow up with that. Thanks again. Hope you're doing well. Have a good evening.